So for a child that actually has acute kidney injury, what would be the prognosis? Now, prognosis is you are trying to access many factors. Now, give a ruling, okay, on the possibility of that child recovering from that disease condition. Now, for a child with acute kidney injury, what will actually be the ruling for this? Okay, what would be the prognosis for this? So prognosis for children with acute kidney injury varies widely, and this is depending on what actually caused it. Okay, how severe was it? Okay, when did they actually start giving treatment? Okay, and was renal replacement required? Did the treatment actually get to the level of renal replacement, that's dialysis or kidney transplant? Short-term prognosis is recovery potential. So children with mild or early stage acute kidney injury recover quickly. Okay, once you remove what is causing it, you start treating. Mortality risk. So AKI, critically ill children, especially people that are in intensive care units, is associated with increased mortality, so most of them die from it. Complications equal to electrolyte imbalance, fluid overload, and infections can even worsen if you don't manage it properly. So long-term outcomes, there's a risk of chronic kidney disease, there's a risk of the child developing high blood pressures, okay, and there's a risk of you treat the acute kidney injury, later on it still results again. So prognostic factors, it depends on how early. Okay, these are the possible prognostic indicators. So if you dictate it early, is fine. If you dictate it late, is bad. If it is mild, is fine. If it is severe, is bad. If there was no dialysis during the process, is fine. If dialysis came in, it shows that you were dealing with an advanced condition. If the cause can be reversed, fine. If the cause cannot be reversed, there's an issue. The child is eating well, fine. The child has not been eating well, okay, or the child has had a bloodstream infection during the course of the acute kidney injury, this usually shows that you are dealing with a much more adverse effect. So in children, you consider that the acute kidney injury could affect their growth and development. Okay, so that's the most important thing that you're trying to treat and solve in a child with acute kidney injuries.